Greetings, this is Joan Lopez Egipciaco. Welcome to my Data Informed Solution Plan for Metro Pavia Health System Incorporated. This solution is focused on business intelligence strategies for preventive care and service innovations. Metro Pavia is the largest affiliated healthcare network in the Caribbean, with 12 hospitals and over 5,000 healthcare professionals. The company also offers medical tourism, home care, and is affiliated to First Medical Healthcare Insurance Plan. Its business mission is to be leaders in the healthcare industry through the integration and development of healthcare initiatives and technology aimed at providing quality of care to all patients. Puerto Rico's population is aging rapidly. 47% of the total population is projected to be 65 years and over by the year 2030, with an increase in crude death rates related to diabetes and heart failure diseases. In 2017, Metro Pavia had revenues of $48 million, ranking second place in comparison with IMA hospitals and Auxilio Mutuo. However, high emergency room utilization is costing $148 million a year to healthcare organizations across the island. Political changes can impact public healthcare funds. Labor reforms implemented by the government last year reduced sick days for employees in the public and private sectors, which hinders the patient's abilities to seek preventive care. Healthcare costs are cheaper than the United States, but this is causing an exodus of medical talent out of the island. Most specialists are concentrated in the metropolitan area, making it a challenge for low-income families and the elderly to travel and receive medical treatment. Social media can hinder preventive care efforts by spreading unverified medical information. For example, anti-vaxxer movements are causing measles cases to reappear in the United States. There is an increase in adoption of electronic health records and the availability of mobile applications and devices to track health data. Businesses are encouraged to transition to electronic records to reduce paper waste. Healthcare providers within the network must be board certified, and all institutions must abide by the Health Insurance Portability and Accountability Act and FDA regulations. Metro Pavia is one of the largest and most complete health systems in the Caribbean, with pharmacies, affiliated practitioners, laboratories, rehab facilities, and home care. The organization's weaknesses reside in the lack of consolidation and reporting methodologies and the high ER utilization and readmission rates. There are opportunities to consolidate transactional data at each business unit to generate insights targeted at improving quality of care. There is also a need to reach certain population groups to provide preventive care and to increase the availability of medical services offered by adding more specialists to the network. Overworked health providers is a threat caused by high ER utilization and shortage of certified physicians. This can result in malpractice lawsuits and quality issues for the organization. Metro Pavia needs to consolidate and use data from different points of encounter within the network to generate actionable data that supports preventive care and increase treatment adherence for high-risk populations. There is also a need to increase availability of healthcare specialists by providing means to integrate them to the health system network regardless of location. Targeting these areas of concern will ultimately decrease ER utilization and increase quality of care. The proposed solutions will be to establish proper EDM and ETL technologies supported by a data governance team composed of medical and executive directors from Metro Pavia. Consequently, the telehealth initiatives powered by Health Catalyst BI will help caregivers reach patients unable to visit a doctor's office, providing preventive care through a mobile app or phone call. Using insights provided by BI dashboards, doctors and nurses can take informed decisions without having to be physically in a room with the patient, providing an opportunity for Metro Pavia to contract providers outside of Puerto Rico. The solution will be divided in 4 major tasks. Each task will address identify gaps and lead the transition to an organization focused on preventive care powered by the insights of business intelligence. The project is expected to mature in a period of 3 years. The first period will be to gather requirements and program definition. The design phase will focus on functional requirements, the deployment of EDM, ETL, and strategies, and the risk factor action plan. Development and implementation will be divided in sprints, while focusing on fine-tuning applications based on results from UAT. New and existing employees will be trained in the new system and project workflow. Understanding the gaps between service expectations and experiences is the first step in enhancing outcome results. Metro Pavia must find a resolution to these gaps in order to maintain its position as leaders of healthcare in Puerto Rico and the Caribbean. A preventive care program powered by business intelligence and the use of technology to connect with patients, regardless of location, is the key to increase patient engagement and healthcare quality. External and internal data needs to be consolidated in a data warehouse. The Metro Pavia data governance team will clean and confirm the data based on risk factors. Health Catalyst's key process analytics modeling tool will be used to transfer the data and ensure compatibility with the BI engine. Health Catalyst BI used late binding approach for dashboards and report to ensure faster processing times. Cross-industry standard process for data mining will be used. The first phase will be to identify the needs and create a data mining plan. The data governance team will work on understanding and identifying important health risk factors to be tracked and create a follow-up action plan. The identified data sources will need to be prepared and modeled in accordance with Health Catalyst BI requirements. Model results need to be evaluated against definitions from step 1 and finally deployed for user access. Health Catalyst BI uses a risk algorithm to determine risk cases. The engine will display if any values are outside of the normal range, so users can proceed with the proposed action plan established as part of the solution. Health Catalyst dashboards facilitate the evaluation of patients without the need of having them physically at a location. Management can take advantage of this opportunity to recruit specialists outside of Puerto Rico. Dashboards can also highlight population gaps to plan ambulatory clinics and vaccination events by region. Finally, utilization can be tracked to increase marketing strategies on critical hospitals and redirect patients to the telehealth service. Current employees must be trained for their roles under the new initiative, and new talent must be recruited for technical roles. Health Catalyst Care Management Suite is being proposed for BI reporting, together with iDrive Cloud Backup Solution for data loss prevention in case of a hurricane. Additional hardware is required for the telehealth initiative, such as tablets, telephones, laptops, and office supplies. The company will deduct an 8% transaction fee from telehealth encounter payments. Adding cost reduction and intangible benefits will result in additional $1.5 million, with an internal rate of return of 51% and a payback period of 1.4 years. These numbers are expected to increase as more physicians join the network and more patients opt in for the service. By bridging the gap of communication and service availability, Metro Pavia can promote a better lifestyle for the people of Puerto Rico, resulting in less visits to the ER and a better overall quality of care. All these strategies combined will secure the organization's positions as leaders of healthcare in Puerto Rico and the Caribbean. Thank you for your time.